Hey, hope you're doing well out there. It's Dr. Matt here. I actually wanted to give you two ideas today on how you can move better, particularly when it comes to your low back. So, one thing that may be overlooked often is how the hips move. So, I'm always thinking upstream and downstream. Maybe why are you compensating getting symptoms through here? And what are some of the things that you can do to help yourself at home, help feel in more control of your health, and help yourself move better? So, I'm going to talk about the hips today. And I want to give you a little bit of anatomy so you have an understanding, and then I'll give you two tests and two stretches to help you out. So the thing is, all your information for how your body works travels from your brain all the way down through your nerves, and travels out. Your spine basically protects your nerves. As a family chiropractor, we're looking to see the structure and function of your nervous system and your spine. And two of the stretches I want to show you right now worked really well with patients in the past, and I think you may benefit from them right now if you're stiff and tight and sore, and particularly in the low back. So your hips have to be mobile, and your midsection actually, you want it to remain relatively stiff and transfer force between the upper and the lower. And if your hips don't move that well, I want you to test right now, and I'm going to show you two stretches. So oftentimes from sitting, this is from to 90 degrees. We got good range of motion there. Anything more outside or inside, things get stiff and tight, and you may be compensating getting discomfort through here. So I want to test internal, external rotation of your hip, and then I'm going to show you two stretches to help. So with this one, what you'd actually do is you're going to lay on your back and you're going to do one of these. So internal and external. And see what the difference is side to side, and then pick the side where you have less range of motion. So right now I'm on my left leg's up in the air, trying to turn it in, and now I'm trying to turn it out. I look at the other side, in, out. I find my right one's a little bit stiffer. So what I'm going to do is first address how it internally rotates like this. So what you're going to do is my right side, my right leg is on the ground. I'm going to hold on to something like the door jamb right here, and I'm actually going to kick up like this in this position. Right foot on the ground, left foot kicked back. I'm going to breathe. I'm going to let my left hip drop to the ground. Notice how I turn in like this. Turn in, 15, 20 seconds, breathing. Hang out there. And take a little break, take a breather, breathe again, and then 15 to 20 seconds. Try it 2 to 3 times. Hang out. And then see again. You can actually retest, see if you got any more rotation. And the other part is the external part, the turning out part of your hip. You have to have great range of motion in your hips. Oftentimes this will help your low back. And the external part is just getting on a soft surface, whether it's couch or sofa or bed, and just bringing your leg up just like this and just turning it out. So I'm going to show you. I'm going to tilt the camera down just a bit so you can see a bit better. Just like this, up nice and tall, stiffen the midsection and leaning over at the hips. And I'm actually going to use my elbow, put a little force this way, put a little force down, breathe, and I may hang out there for 45 to 60 seconds. Try that once or twice. And then see again how you move, how you internally and externally rotate. Anyways, I'd love for you to give that a try. Let me know. Oftentimes, if you're consistent, pick a time, whether it's morning, after your lunch break, and in the evening again, and you do it repeatedly, you'll find your hips start to loosen up. Give yourself a good few weeks at least to start into that of consistent action to notice a difference. And oftentimes, if you address how your hip moves, you'll begin to help how you move altogether and help if you have challenges through here. So that's really good for at home. And I'd love to hear how you make out. Let's get to it. If you're watching this right now, make sure you take a little standing break, go for a 5-minute walk, move around, and I'll talk to you guys soon. Have a great day. Bye for now.